Local NHS bosses have now launched a formal consultation on their plans for the future of healthcare in South West London and Surrey. Their preferred option is to remove all acute services from Epsom Hospital and St Helier Hospital. This would mean the removal of A&E, maternity, children's, intensive care, cancer care, coronary care, emergency surgery and emergency medicine from our 2 nearest hospitals. They say that they would like to provide a single new acute facility to replace those services. This facility might be located at St Helier Hospital, it might be located at Epsom Hospital, or the preferred option is next to the Royal Marsden in Belmont. If this dangerous plan is carried out, it would mean fewer beds, care delivered by fewer consultant doctors, longer journeys for most people, a single A&E and maternity in place of 2, and a facility which is only accessible via emergency ambulance or with a referral from your GP. On the 6th of January 2020, a meeting was held in Bourne Hall in Ewell, where the NHS bosses took the decision to do this. The general public are clearly not convinced by their dangerous plans, despite their attempts to paint the downgrading of 2 of our existing major acute hospitals as if it were a good thing.
Can we try and keep these questions quite brief so we can cram in 3 bang? Or is that possible? Do you want to go first, sir, and then I'll come to you? Sir.
Thank you. My name's Dave Ash. I'm part of the Keep St Helier Hospital campaign. Most of the board are familiar with who I am, and I certainly know who you are. First question. The clinical Senate's report that was published before the pre-consultation business case made it very clear that there were 4 options in your pre-consultation business case that was never published. The 4th option that's missing from your currently published pre-consultation business case is the option of no change. So first question is, I'd like to know why that change was made, why that was removed. Secondly, I think it's quite ironic that you have the audacity to call yourselves improving healthcare, well, anything, because what you are proposing is providing acute care on fewer sites with fewer acute beds, at best 2/3 of the acute beds that we already have, with fewer consultants located further away from most people, which would only be accessible via an emergency ambulance or with a referral from your GP, and we all know how easy it is to get a GP appointment these days. So I would like to see some evidence that that will improve anything, because I've asked for this particular question at various CCG board meetings and at hospital trust meetings, and I'm always told about fractured neck of femur and about stroke care. But that's not what we're talking about here. We're talking about A&E, maternity, paediatrics, intensive care, cancer care, coronary care, emergency surgery and emergency medicine. Those are the services that you intend to remove from both of our local acute hospitals. So I'd like some evidence. And finally, the CCG board members who are present here today, you represent members. You have GPs who are your members. I would like to know if you have carried out a survey or a vote of your members before you took today's decision, because do you know what? I think most of the local GPs, A, don't know about this, and B, would probably not have endorsed the action that you have already taken today. So I'd like some answers to that, please.
All right, and I'm going to be cheeky. Sorry to load on, but I'll come to this gentleman as well.
It's good to hear about the plane. My name is James Woodhouse, and I'm Professor James Woodhouse, and I'm a forecaster. It's good to hear that the Plain English campaign has been near your models, your metrics, your net present value, your suites of documents, your mobile roadshows, and your focus groups. But I would like to know, when you say 85% of services will be retained at St Helier and Epsom, how do you measure that 85% exactly? And why is it that your forecasts, and I've been a professional forecaster for 40 years, why is it that your forecasts are so vague about 2025 and 2030? Why are they so complacent about transport congestion, about the state of this country's infrastructure, about population growth and all the rest of it? Why are you so seamless in your prognostications about how people will only have to spend another 5 minutes travelling, and they won't mind that if they get a better service. It all works perfectly in your wonderful 3-option world. But will you, as the last speaker said, include the 4th option, or do you want to cover us not in democracy but in technocracy, and your language and your myopia about the future and your mendacity that has been repeated for so many years in this attack?
Thank you very much. Okay, so quite a lot to get through. Sorry to load quite a few on there. Yes, please.
Yeah, so just a few, I'll try and get through a few of these with colleagues. But so we've included within the pre-consultation business case the no change. It is there as a comparator. We're required to do that as part of developing a business case, and we've done that as part of the option appraisal. But we have set out what we think are the 3 options that we want to consult on, including a preference. So it is there as a comparator, and it will be a matter for people to give their views during the consultation about all the options. And of course, it is a matter for the public to give its views as well about no change as an option. And we'll consider all of the evidence as part of that. We've tried to be we're trying to use as simple as language as possible in all of the documentation. We can only be guided really by the plain English campaign. We are not experts in doing this. If there are other bodies that you think can help us with it, then we are very, very happy, and I'm happy to take suggestions on that.
Sustainable.
On the point about the 85% of services remaining local, the measure that we've taken looks at the volume of contacts that go through the hospital, each of the hospitals at the moment, and largely demonstrates, I think, that the majority of services will continue to be available.
So it's largely 85%, is that right?
It's 85% based on the number of contacts measured across the hospital's activity that go through. It is a measure that we have used, and it is a measure that therefore we have tried to explain in language in the documentation. We do take, and on the final point around transport and roads, we do accept that there will be an impact for all the options in terms of access to transport. There is a suggested number of potential mitigations that is set out in the integrated impact assessment. We will need to look at that very, very carefully with any other suggestions around mitigations on all the options as part of the next stage of the integrated impact assessment. Some of those will require investment, some of those will require working very closely with the local authority and other voluntary bodies as part of that. But we will take it very, very seriously, and I know members of the governing body feel that.
I think within that there was an issue about membership.
Yeah, so I was just going to pick that up, because of course we've been engaging with our local GP membership throughout this process, because they're the ones who have day-to-day contact with our patients, so their input is incredibly valuable. And in fact, as CCGs, we are representing our GP members as well. We've worked with them on these proposals. As part of the work, as has been mentioned, we looked at the no change option, so keeping services as they are. We could not recommend that option, and my GPs are completely behind this. We couldn't recommend that option because we couldn't recommend an option that does not improve the standards of care for patients, and that's why we've started this process, because we're not meeting clinical standards. Our patients are not getting the standard of care that we would like to see, despite the staff working very hard and filling in on rotas. We know that we need the right number of consultants working together on one side to get the best outcome of our patients, which is why all my GPs in Merton are fully behind us making change to improve the quality of care.
Did you carry out a vote? The people behind this dangerous plan are putting consultation leaflets through your doors. It explains their 3 options, all of which would see acute services removed from one or both of our local major acute hospitals. The document does not contain an option to say that you disagree with all of their proposals. If you receive one and you decide to fill it out, then we suggest that you tell them, in no uncertain terms, none of the above. Tell them that we need to keep all services at all of our existing hospitals. We need more beds, not fewer. We need more doctors, not fewer. We need more hospitals, not fewer. We need more capacity, not less. And you might like to sign our petition at koshh.org/petition. This might be our last chance to save our local hospitals.